work so hard, you're hurting yourself. But I'm a 90-hour-a-week working guy, and I don't know, so far, hey, I'm fine. Shed some light on it. Continue. This is exciting. This is exciting. I want to get to the. Give me some answers here.
Okay. I have problems with my colleagues who have 45-degree brushing, because if you brush at 45, the bristles never get in between your teeth. They only go on the roundness of your teeth that are on the cheek and lip side of the teeth. You brush, unless you press hard and force those bristles into the sulcus and in between your teeth and go back and forth, you're never going to clean at a 45-degree angle. It'll never do anything. It'll never get the same result that you get with brushing.
Let me ask you something. As I said, I'm looking at it now from a common sense and or from an engineering viewpoint, which I am. So you have your teeth, you have your gums like this, and they have like for all purpose. Can I call a socket a bucket? Can I call that the same thing than where the ground and the tree would come together, and you have that little thing in it?
Yeah, it's a little ditch around the teeth.
Exactly, a little ditch. Good. I like that word. A little ditch around the teeth. So if I do in a 45-degree angle, wouldn't I get those bristles of that brush in it easier than?
But you're brushing at 45 degrees at a different angle than you're doing. It's the opposite way. And so, if I'm holding this brush here, I'm holding it at right angles here.
Right.
Then I would turn it like this, and when you turn it like that, it doesn't get in between your teeth.
Really?
The bristles don't get in between the teeth because just the physics of it prevents it from going in between the teeth, the bristles, forcing you to floss. And
so what you're saying here, what you're saying here, you hold it on a right angle, the bristles bend, and they bend in the perfect way to go in it. You hold it in this way, they bend, and they bend away from it.
Yeah, and so if you do it at 45 degrees, the gum tissue in between your teeth is swollen.
Interesting. Very interesting. Very interesting. Very, very interesting. For instance, one thing I like, with what you say, and of course we like things we like. I go and start with my wife brushing. We usually at the same time. Frankly, the evening time when we go to the bathroom is a 2-hour procedure for both of us. That, be it in the bathtub, sitting, talking, and no matter how much she takes longer, I sit there and we talk. And my wife, just like with chewing, my steak is finished. She has the first bite still chewing, like a cow. Brushing, we both start brushing. I shave, I wash I may be taking a shower if we don't do our, the bathtub together, which we do a lot. I'm all done. And she's still brushing. Actually, one time we were in India, we lived there for a couple of years, and we went to a dentist together, which is, one of our clients and stuff, and the guy actually did say, he says, Helen, I think you're brushing your teeth away.
Oh.
But, so what I like this, this doesn't have to be a long time. Brush it hard and stiff. I like exercising like that. I don't like going on the treadmill for 3 hours, light and smooth. I go and I go like within 2 minutes, my breath is out, and I do it so strong that within 4 minutes I'm half dead, and then I stop. Personally, I think this is much more convenient, and I think it gets more done. My opinion. I'm not trying to make a point out of it. But that's your way of brushing. I like that.
Yeah, in dental school. When I went to dental school, in histology, that's a study of cells, And so we had 3 slides that we had identified in our testing. And the 3 slides were one of the tissue from the bottom of the feet, the other was the tissue from the palm of the hand, and the other was tissue from the gum tissue around the teeth. And you can't tell the difference. You cannot tell the difference if you look at those 3 slides.
Well, makes sense from what you said at the beginning. If that part of the skin or whatever you call it in the gums, if they would have some type of funny sensitivity, boy, I mean, how are you going to eat a peanuts or any something? I mean, it's harmful. It wouldn't be good. It wouldn't be. It would be painful.
And if the patient is not brushing and has their gum tissues in shape, in the mouth, they're all the same color. If they are brushing and getting their gum tissues in shape, calloused like the palm of your hand is after you really worked on the jungle gym, well then you notice that the gum tissue is pink. And the rest of the tissue is that you can see a line right there on the right next to the teeth, and it goes down maybe a quarter to 3/4 of an inch. It varies on all the patients. But if you brush that and get it in shape and tight around the teeth and take everything out of the sulcus twice a day, you're far ahead of any other method of brushing.
Absolutely great. Absolutely great. Well, answer me one more last question here, which I didn't get an answer. Soft brush, hard brush, or a middle brush?
All the brushes in the United States, since we got away from using hog bristles, that's what we used to use. In fact, a guy in San Jose here, actually, a guy named Dr. Hudson, developed the Oral-B toothbrush. And when he did that, he used nylon bristles, and he cut them, but then he flamed them and made them round. And today, that's the standard for all toothbrush manufacturers in the United States. All the bristles are cut and rounded. They're not sharp, and so you can't injure your gum tissues with that. All you can do is strengthen them. So it doesn't make any difference whether you use a medium or a soft. I don't think there are any hard brushes around. In fact, the brushes that are used on the mechanical brushes, the ones with the battery or electrically powered, they are made so soft because those people feel like that they're going to injure their patients and they have a liability there. They're so soft that after you use the bristles, those brushes, for about maybe 2 or 3 brushings, you can notice that the brushes are starting to flare. And then you got to spend $6 a brush to get those. And if you use them over braces, they are absolutely destroyed in 1 week. And then hand brushing is the best.
So I can see you're not
picking, is another thing.
Right, so you're not a favor of electric rotating toothbrushes.
No, the bristles are really too soft. The rotating ones are probably better than the vibrating ones. And if you are willing to put the money up and buy new brushes all the time, then you can have good brushing with the rotary brush.
But you still hold them in the right angle, and you still then go like this.
Absolutely, yeah. And they bend over and they get into the sulcus and in between your teeth.
Well, all right. That was interesting.